So let's get started. So first, let's talk about IM syringes. So your diameter is going to range from 18 to 25 gauge. The smaller the number, the larger the diameter. Therefore, an 18 gauge has a much larger diameter than a 25 gauge, which is again going to be on the smaller side. Your needle length is going to range from 5/8 to 1.5 inches, and you're going to have to determine based upon the site that you're using and the patient and their conditions which size needle you want to use. Your angle is going to be at a 90-degree angle. So you're going to grab that syringe and you're going to aim it like a dart and you're going to inject it at a 90-degree angle into the site. The first site we're going to cover is your deltoid. It's a very easy, accessible site. It's frequently used for immunizations. It's a very small muscle. Therefore, we're only going to choose this site if we're going to be delivering a small amount of fluid. There is a potential injury for axillary radial ulnar nerves and the brachial artery. We don't use this site for infants and children. So your anatomical landmarks for the deltoid muscle, what you're going to do is you're going to take your two fingers and you're going to place them at the acromial process, and then you're going to go right below there. So two finger breath widths right below the acromial process, and that's how you're going to find where to insert on the deltoid. Your next site is the vastus lateralis. It lacks major nerves and blood vessels. It's a very thick and well-developed muscle, and it's going to be our preferred site for infants as long as if they're less than 12 months. The markers for the vastus lateralis, you're going to place your palm on the greater trochanter, and your fingers are going to be kind of pointed toward your kneecap. And then your other palm is going to be placed on the femoral condyle. And again, your fingers pointed toward the middle there at your kneecap. And what you're going to do is that breaks it up into thirds. And so that middle of the muscle there on the lateral side is the injection site. And as you can see, the X is marking the spot on your photo on the screen. The ventral gluteal. Okay, so this is a very big muscle and it's a deep site. It's situated away from your major nerves and blood vessels. This is going to be the site that we choose if we have a large volume or a fluid that's very viscous or irritating. This is the site we're going to choose. So if someone comes into the emergency room, for example, and we need to give them an IM dose of antibiotics, this is the site we're going to choose because it's a large volume. So it's a well-developed muscle in young children, even if they're not walking. So we're going to use this if they're greater than in 7 months. To find your anatomical landmarks for the ventral gluteal, what you're going to do is you're going to place your palm on their greater trochanter of the femur. So the larger picture on your screen, that is on the patient's left hand side. So we're going to use our right hand and we're going to place our palm on the greater trochanter. We're going to take our pointer finger and we're going to spread and make a V, and we're going to take that pointer finger and it should be pointed toward the anterior superior iliac spine. And then your other fingers need to be pointed toward that iliac crest. And so that triangle that you've made is where you're going to inject the fluid. And if we're going to take the patient and we're going to inject it on the patient's right hand side, we're going to use our left hand and we're going to use that left palm and place that on the greater trochanter. Your pointer finger is going to again be pointed toward the anterior superior iliac spine. And then your other three fingers are going to be spread, making that triangle. And those three fingers are going to be pointing toward that iliac crest. And that green dot on that smaller photo is where you're going to be injecting again in that triangle. So that sums it up. Those are your three major sites for IM injection. Hope you have a wonderful day.